We're definitely talking about a very pertinent issue this morning in our house slot. We're looking at systemic lupus erythematosus. Hopefully I did it right, Doc. I did justice to the name, simply known as lupus. It is an autoimmune disease which is known to attack the human body's immune system and various organs throughout the body. Now, prevalence stats, when you're looking at it, are largely unknown in South Africa, and basically what they're saying is that it's about a rough estimate of 12 per 100,000 individuals. That equates to about 66,000 individuals that are affected by lupus. However, to tell us more about this chronic connective tissue disease, we've got in studio dermatologist Dr. Karen Koch. Of course, we invite you this morning to be part of our conversation. Remember, we also have the Ask the Doctor question and the segment of it where if you have any questions, especially when it comes to your skin or any sort of skin-related ailment, give us a call on 011 447 1742, alternatively 1620. Remember, we're also available on our Facebook as well as our Twitter pages. Thank you so much for joining us this morning, Dr.
Thanks for having me.
Lupus, what are we talking about? Or is it SLE? That's the formal
No,
term.
the easiest way is to say SLE or
Okay.
lupus is fine. We understand what you're talking about. So thanks for having me. Obviously, we're trying to raise awareness about this condition. We've got lots of patients with it. Not much is actually known in the general public. So it's a fascinating condition. It's terrible for the people who've got it. It's an autoimmune condition, which means that the body's immune system that's meant to protect you is essentially attacking yourself. And the reason
So your immune system is attacking you?
Yes.
Okay.
So it's actually producing antibodies and so on that attack the person themselves. So the real problem with this is, you know, the symptoms can sometimes be quite subtle. It starts usually with extreme fatigue. Sometimes patients then will get a bit of hair loss, this brain fog where patients feel a bit confused, maybe not focusing as much as they could. And then, you know, it can progress. So joints are the most commonly affected. And in the long term, the reason why patients suffer so much is they get kidney disease, sometimes requiring a kidney transplant in the long run, which, as we know, is difficult in South Africa. Okay. So it's really an important condition with long-term consequences, both in terms of like everyday function, but also in terms of, you know, mortality over a period of time. So the risk of dying, in fact, from this condition.
Sure.
Yeah.
And obviously, you know, when we're speaking about lupus, the assumption will be somehow it also appears or sometimes it shows on the skin as well.
Yeah, yeah. Well, most often, so that's why I'm here. So I'm a dermatologist.
Yeah.
So the reason we see it is about 80% of patients will have some skin signs, and in about 40% of people, it's the very first sign. So
the very first sign,
yeah, will be a rash. So usually it's a sun-sensitive condition. So we tend to see it on the face, the cheeks, you know, forearms, anywhere that's exposed to the sun.
So what does it look like? It looks like a rash.
So it looks like a rash, but a red, what we call erythematous, so red rash. However, if you think about people like Seal, for example, right? You know that on his face, we often think he's got acne scars.
I thought that it actually was burnt or there was a...
No, so he's got a type of lupus that leaves very deep scarring on the skin. So that'll start as a scaly sort of red rash that then progresses to these deep scars on the face, on the scalp, and so on. The other quite common sign is hair loss. So, you know, hair loss can be, there's a variety of causes.
Yeah, people automatically think it's alopecia.
Yes, yes, exactly. Well, I mean, alopecia just means, in general, hair loss, but there are lots of different causes. So, you know, we talk about stress and we talk about thyroid and lots of things. One of the things that we test for is lupus if someone comes with hair loss. So it's why important to get these things checked out really. So skin rashes, easiest thing to see. What they talk about when you look up lupus is a thing called the butterfly rash.
The butterfly rash.
Butterfly rash. And that's why you'll often see the butterfly as the symbol for lupus, this little purple butterfly if you go online and you look it up. The reason is that you've got this rash over the cheeks, and I think if you can imagine it, it I suppose means it looks like a butterfly. So really interesting is the word lupus. You know, skin goes back way back when, you know, you couldn't see many signs in the body and so on. So when you look at the ancient Greeks and so on, lupus it's a very old condition recognized over, I mean, obviously it's been around for ages, but recognized over thousands of years. And the reason is the word lupus comes from the word wolf. And the reason is that they thought that it looked like a wolf bite. Now, obviously, we don't see wolf bites very commonly anymore.
Well, from wolf to butterflies. So
we're quite descriptive here in our terminology.
When we're looking at, you know, when does one get affected, or what are the factors that actually causes one to have lupus? Are you born with it? Do you get it? Is it because there's something that happens with your immune system? What happens? What causes an individual?
So we don't have the full picture.
Yeah.
You know, what we understand is that something goes wrong. So we think that there's a genetic predisposition, and we do have families that come in where there's a mom or a dad or someone who's got the condition, and but that's only about in 10% of patients where you get an actual, first-degree relative, which is what makes it so hard for the diagnosis. That's why people aren't aware about it.
So then what about the statistics of that 1 to 12 individuals that are affected by it then?
So, well, 1 to 12 would be, you mean in terms of family members?
Well, 1 to 12 in terms of those who've got lupus.
Okay, so in terms of those who've got, we see...
Or 12 per 60 or...
Per 100,000, yeah. So we know that there's a female predisposition, so something to do with hormones perhaps. Okay. So we find it in women who, it's postmenopausal, it's there, so usually time of puberty, so anywhere from there, we talk about childbearing years. So during the times where you've got estrogen, we think that there's a link, and that's why women are 9 times more commonly affected than men. I mean, that's a massive...
9 times more affected than men.
Massive predisposition.
Sure.
So we think there's a hormonal change, right, firstly. Then something triggers it. Sometimes we think it could be stress, we think maybe viral infections, and sometimes certain medications that one might use.
Gotcha.
But obviously not everybody who takes those meds or who is exposed to that type of stress gets the condition. So there must be some genetic predisposition. Do you know what I mean? We know there's something. We're trying to look into it because if we knew more, perhaps we could prevent it.
Yeah. And very quickly when we wrap up, and I know that this is a power-packed conversation, but how do we treat it?
So lupus, you've got to get to a doctor who, recognizes it firstly, and then the treatment is multifactorial. We go with lifestyle changes, we try and put you on a sort of healthy diet, and then you need medication. You need to be on, we use medications like anti-malarials, funny enough. It has a calming effect on the immune system. Sometimes we have to go as far as immunosuppressants. If it's just the skin, we can often manage it with corticosteroids and topical creams.
Got you.
So there are various different things depending on the individual.
But the trick is just to recognize them. The trick is
to recognize
if you see a rash, is it a sore rash though? Is it a painful
itchy,
rash?
Often itchy, sometimes painful, mostly itchy more than anything else. But it can be painful, very red, often sudden onset, hair loss, severe tiredness, joint pain. Anything with swelling of the joints where you wake up in the morning. But that tiredness is something I really wish that people knew more about. After where you literally have to lay your head down in the afternoon to have a nap at work because you're just not coping.
And that is a sign, everybody.